Hi everybody, Dr. John here. In this video, we are going to be discussing anatomy of the brain and some of the blood supply to the brain to better understand what occurs during a stroke. The brain is a very complicated organ. There are many components. The brain has a few key structures that we want to zoom in on. In our frontal lobe, we carry out a lot of our thought, higher level planning, and the back of the frontal lobe has the motor strip responsible for moving our arms and legs. After our frontal lobe, we have our temporal lobe, we have our parietal lobe, and we have our occipital lobe. And then we have our cerebellum. A stroke at the temporal lobe might prevent us from hearing properly. A stroke at the parietal lobe might prevent us from processing information and making sense out of different information coming in at the same time. Our occipital lobe is responsible for vision. Our cerebellum is responsible for balance. If somebody had a stroke at their cerebellum, they might have some balance difficulties with coordination. How does blood get delivered to these various parts of the brain? Blood is pumped out of our heart as it begins to enter the aorta and immediately is shunted up towards our brain. In the front, blood travels up through internal carotid arteries. In the back, through our vertebral arteries. These arteries form what is called the circle of Willis. The circle of Willis runs throughout our brain and it branches off into different arteries. In the front, we have the anterior cerebral arteries. Then we have our middle cerebral arteries, posterior cerebral arteries. In the back, the vertebral arteries form the basilar artery. Just like pipes carry water, if a pipe is blocked, the water will not be able to travel. If an artery in the brain is blocked, blood will not be able to travel through it. Depending on which artery might be blocked, we would expect functional deficit in that location of the brain. In the next video, we are going to discuss the pathology, the different types of strokes that occur, and how they occur.